Down syndrome is a genetic disorder. It is caused when abnormal cell division results in an extra, full, or partial copy of chromosome 21. The extra genetic material causes developmental changes and physical features of Down syndrome. Down syndrome varies in every person. The severity of this disorder is also different from person to person. Symptoms of Down syndrome cause delays in the developmental process and a lifelong intellectual disability. Some individuals can live a long and healthy life while others aren't so lucky. Some have significant heart problems like heart defects. Individuals with Down syndrome also have very distinct facial features. Some of these facial features include flattened face, small head, short neck, protruding tongue, upward slanting eyelids, unusual shaped or small ears, poor muscle tone, short hands with a single crease in their palms, relatively short fingers, small hands, small feet, excessive flexibility, tiny white spots on the colored part of their eye, and short height. If an infant has Down syndrome, they are typically shorter than other children of their same age. They also develop intellectual disabilities, which include mild to moderate cognitive impairment. Their language is delayed, and both short and long-term memory is greatly affected. A parent can find out during the first or second trimester if their baby has Down syndrome. There are no symptoms a parent will have from carrying a baby with Down syndrome, so to find out, they can get extra screening done during an ultrasound or get a blood test done. Since Down syndrome is genetics, the symptoms will start occurring during the early weeks of pregnancy when the fetus is first forming. A doctor can look for certain features in an ultrasound, such as flat facial features, small head and ears, dilated brain ventricles, increased thickness of the back of the neck, and many more. Some parents have a greater risk factor of having a baby with Down syndrome. Advancing maternal age is one of the risk factors. As a woman gets older, she has a greater chance of having a child with Down syndrome. Once a woman reaches 35 years of age, the risk increases. Another risk factor includes being carriers of the genetic translation for Down syndrome. Lastly, having had one child with Down syndrome also increases the risk of having another child with the disorder. Not all Down syndrome is inherited. It is an error in cell division in the early stages of development. The only type that can be inherited is translocation. A parent can have rearranged chromosomes and not display symptoms of Down syndrome, but can pass the unbalanced genetic material to their kid, and their kid can display symptoms. Only 4% of individuals with Down syndrome have the type of translocation, and of those 4%, only 3% of it is inherited. Treatments for Down syndrome are usually based on each individual's physical and intellectual needs. A child with Down syndrome usually receives special care from their physician, special educator, speech therapist, occupational therapist, physical therapist, and social worker. Many of the conditions associated with Down syndrome are treated right after birth. Sometimes throughout childhood and adolescence, long-term treatments are needed. Children, teens, and adults still need the same care as a person without the disorder. For example, well baby visits and routine vaccinations are needed as infants for reproductive counseling and cardiovascular care later in life. People with Down syndrome also have early intervention and educational therapy. Early intervention refers to a range of specialized programs and resources that professionals provide to very young children with Down syndrome and their families. Most children with Down syndrome are eligible for free appropriate public education under federal law. There are 3 types of Down syndrome: trisomy 21, translocation, and mosaic Down syndrome. Trisomy 21 accounts for 95% of the cases. This occurs when there is a problem with the cell division and results with an embryo that has 3 copies of chromosome 21 instead of 2. Translocation Down syndrome occurs when a copy of chromosome 21 attaches to another chromosome, typically 14. The chromosome count will still equal 46, but the chromosomes are not located in the right place. This type accounts for 4% of the Down syndrome cases. Mosaic Down syndrome occurs when there is a mixture of the 2 types of cells, some containing 46 chromosomes and some containing 47. The cells with 47 chromosomes have an extra chromosome 21. This type is the least common and accounts for 1% of the cases. People with mosaic Down syndrome have less characteristics than the other. Down syndrome has a variety of complications that become worse with age. Some complications include heart defects, immune disorders, obesity, spinal problems, leukemia, and dementia. Down syndrome occurs in approximately 1 in every 700 babies, which makes Down syndrome the most common chromosomal condition. There are about 6,000 babies born every year in the United States with Down syndrome. The lifespan for a person with Down syndrome has greatly increased. Today, they can be expected to live for more than 60 years.